Hello and welcome to the Little Medic channel. Today we will be talking about Generalized Anxiety Disorder. Generalized Anxiety Disorder, also known as GAD, is characterized as a disproportionate worry about everyday issues compared to any inherent risk. GAD affects 1 in 25 people in the United Kingdom, with less than 50% of people seeking treatment. Additionally, 33% of people receive inadequate treatment. GAD has numerous risk factors. Let's have a look at who is at risk. Female gender, comorbid anxiety disorders, family history of psychiatric disorders, childhood adversity, history of physical, emotional, or sexual trauma, low socioeconomic status, substance dependence, chronic physical condition. Now we know who is at risk. Let's have a look at the signs and symptoms of GAD. Sleep disturbance, headaches, irritability, dry mouth, muscle tension, hyperventilation, poor concentration, tremors, restlessness, palpitations, fatigue, and chest pain. So when do we consider GAD? A person who reports chronic excessive worry which is not related to a particular circumstance. Symptoms of physiological arousal such as muscle tension, insomnia, restlessness. People who frequently attend healthcare services who are constantly worrying about a variety of issues, have a chronic physical health condition, or are seeking reassurance about somatic symptoms. Don't forget that some people with GAD may only present with physical symptoms. Therefore, remember to screen for GAD. We have now looked at who might be at risk of GAD and what they might present with, so let's move on to how to diagnose it. According to the DSM-5, diagnosis can be made if the person has excessive worry that is difficult to control that has been occurring for the majority of days for more than 6 months. This should not be attributed to any other mental health condition or substance. It should also cause significant impairment in occupational, social, or other areas of functioning. For a diagnosis of GAD, the person must also have 3 or more of the following symptoms. Easily fatigued, difficulty concentrating, sleep disturbance, restlessness, muscle tension, or irritability. Now, we know how to diagnose this GAD, but how can we screen for it in those who do not directly present with it? Here we have GAD-7, a tool which can help identify people struggling with anxiety or help to monitor severity of ongoing symptoms. As you can see, there are 8 statements which the patient has to consider for the last 2 weeks. These statements are: feeling afraid as if something awful might happen, becoming easily annoyed or irritable, being so restless that it is hard to sit still, trouble relaxing, worrying too much about different things, not being able to stop or control worrying, feeling nervous, anxious, or on edge. The patient ticks if this statement affects them nearly every day, more than half the days, several days, or not at all. Patients scoring 0 to 4 have no or minimal symptoms of GAD, 5 to 9 have mild symptoms, 10 to 14 have moderate symptoms, and 15 to 21 have severe symptoms. So what is the management of GAD? Step 1. Inform the patient of the diagnosis. Provide information on treatment and the nature of GAD. Initiate active monitoring. Treat any comorbid conditions. Discuss sleep hygiene and regular exercise. Step 2. Offer one of the following: individualized, non-facilitated self-help, individual guided self-help, psychoeducational groups. Step 3. Offer one of the following: high-intensity psychological intervention, CBT, or applied relaxation, drug therapy such as sertraline, or offer an alternative SSRI or SNRI if sertraline is ineffective. Step 4. Offer any intervention previously not tried or refused. Offer referral for specialist input. Advise carers about the right to a carer's assessment and assessment for respite if required. Now we know the management, Let's consider the doses for the drug therapy. Sertraline, starting dose of 25 mg daily, then increased to 50 mg daily after 1 week. It can be increased to 200 mg daily in intervals of 50 mg every week. Paroxetine, starting dose of 20 mg daily and can be titrated up to 50 mg daily. Escitalopram, starting dose of 10 mg daily. It can be increased to 20 mg daily, except in the elderly and those with reduced hepatic function. Always check local guidelines for drug therapy. So, what advice needs to be given with drug therapy? Patients under the age of 30 on SSRIs or SRNIs are at an increased risk of suicidal ideation and self-harm in the first week. Adverse effects in the early treatment of SSRI or SRNIs include anxiety, agitation, and sleeping problems. Patients started on any medications will need regular reviews. How do we monitor GAD? Patients under 30 years old who are on SSRIs or SNRIs need to be reviewed within the first week and then 1 month later. Suicidal ideation is an important factor to consider during reviews. For patients on other treatments, review after 4 to 6 weeks of treatment. During reviews, ensure to assess severity, risk assessment including suicide risk, functional impairment, treatment effectiveness, the patient's treatment preference, comorbid conditions. What are the complications of GAD? The complications of GAD include distress, disability, impaired quality of life, impaired social and occupational functioning, psychiatric comorbidities, physical comorbidities, and suicidal ideation. So in summary, generalized anxiety disorder is characterized as a disproportionate worry about everyday issues compared to any inherent risk. Severity can be assessed by the GAD-7. Symptoms include restlessness, fatigue, and sleep disturbance. Risk factors for GAD include childhood adversity, low socioeconomic status, and substance dependence. GAD can be managed through active monitoring, self-help, psychoeducational groups, high-intensity psychological therapy, and drug therapy. After initial management, regular reviews need to consist of severity, risk assessment, functional impairment, treatment effectiveness, the patient's treatment preference, and comorbid conditions. Complications of GAD are distress, impaired quality of life, psychiatric and physical comorbidity, and suicidal ideation. Thank you for listening to the Little Medic channel. Like and subscribe to get more Little Medic content.